I'm joined by Shannon Ducat, the Associate Vice President of Patient Access at ProMedica. Shannon will be joining the upcoming healthXchange Patient Access Excellence meeting taking place Tuesday, November 12th, on a panel discussion focused on the development of strong governance structures to help build high-functioning patient access teams. Shannon, thanks so much for joining us today. To get started, could you tell us a little bit about your professional background, both how you got your start in the healthcare industry and some of the roles that you've enjoyed so far?
Currently, I am the AVP of Patient Access here at ProMedica Health System. I have been with ProMedica for 22 years now. I actually started out as a patient registration specialist at a pediatric office. Kind of started in that patient access, kind of realm. I was there for 7 years, kind of at that point we were still on paper charts and doing charge entry, by hand and things. So, very manual processes. And then from there, I kind of just, once I got my foot in the door at ProMedica, I was, kind of like, okay, I like this. I think I could make a career out of this, so I went on to be a trainer for the front end, so kind of training on the different, I think at the time we were on Athena, so just kind of training front end workflows and, different education and things. And then, I knew that I wanted more, so kind of took a turn and got into a leadership role. So I was a manager for quite a few different provider offices, ortho, pediatrics, family practice, just to kind of get that leadership background, knowing that, I wanted to continue to advance. And then in 2015, ProMedica opened their first health and wellness center. And it was one building that had provider offices, outpatient surgery, lab, radiology, and it was the first time we had ever done a centralized registration. And so I was very interested in that role. And then once I got into that role, I knew patient access was where I wanted to be. I love the operations. I love, process improvement, the technology that continues to come and evolve with Epic. So that's kind of what's led me and guided me here to my current role.
Absolutely. And patient access teams are facing a lot of challenges. They look towards the end of 2024 and kind of into 2025. What are some of the challenges that you and your team are currently working to solve, or challenges that you're working to address this year and kind of into next year?
So I think, a lot has shifted within patient access, and there's more accountability and responsibility on the front end, making sure that patients that are being seen are financially cleared. Are they in network with, our facilities? Is what they're having, the service that they're having, a covered benefit? So all of that falls on registration, all the different plans that we have. And I think if I had to name one challenge, it would definitely be that financial clearance, trying to work to get patients who are uninsured on a Medicaid or financially cleared with financial assistance, or if they're out of network, ensuring that they have out of network benefits, and just making sure that the patient is aware of their financial responsibility, because it's so common for them not to understand at all what their benefits are and what they're going to owe from these services. So just the education part that is on the front end to inform the patients, I think, is the biggest challenge nowadays that we face.
And I think that that's such a common challenge. I mean, a lot of patients think, I've got insurance, I'm all set. I don't need to worry about it. But they don't understand, or they're not aware of all of the intricacies that go into copays, co-insurance, deductibles. There's so many different elements, and the front-end access teams are really taking the charge on providing that service and education and care, and it's such an important aspect of enabling patients to get access.
Mhm. Yes, I would agree. I mean, providing estimates, the No Surprises Act, just price transparency in general. And then when you're having those conversations, they tend, you got to have that customer service aspect too. So it really has, been more of a shift to more responsibility and accountability on the front end, where in previous years, a lot of that was on the back end, and it's just not the way that the direction is going anymore.
It's tough, a big
Yeah,
challenge.
it is tough.
We really appreciate you joining our upcoming panel on developing strong processes and governance structures that help to support patient access. What's one area that you're looking forward to discussing with the panelists and the audience during the meeting?
I think, right now, with, just the administrative burdens that we have in prior authorization and, on the front end, creating estimates and, authorizations and things like that. What are some of the tools that other organizations are using? Here at ProMedica, I've been trying to rely a lot on some self-service tools for patients so that they can kind of almost be our best employees too, and do some of that work for us so we can concentrate on the other, things that we need to be doing, such as automation and things or authorization. So just trying to understand, what kind of tools the organizations are using, how much they're doing in self-service realms. And again, just, the shift in responsibilities on front end and how they're tackling that. Because really, I think best practice, we all have to work together and kind of share what we're all doing instead of, fighting and trying to come up with some of these workflows on our own.
100%. And we really enjoy seeing that collaboration during the meeting. And we look forward to you joining us. And thank you so much for coming on today.
Yes.